Hello, my name is Maggie. I'm an occupational therapist and this session is about relaxation. I'm going to talk briefly about how relaxation can help in the management of stress and anxiety, and I shall also demonstrate one very quick relaxation method, so be ready to try it at home. It is normal, of course, and necessary for us all to have emotional responses to events and circumstances in our lives. A diagnosis of cancer sparks a huge range of emotions. We may be worried about work and family, telling family and friends, finance, possibly have uncertainties about the future and what treatments might be, also coping with those treatments, making sense of lots of information, and even returning to a normal routine after being discharged from a specialist can all demand emotional adjustments for you and those around you. As individuals, we have our own ways of coping with challenges, and usually we rise to them and accommodate our reactions. Sometimes, though, the challenge is prolonged, or we might think it is far too big for us to deal with, and this is when the stress response comes in. Often, time can pass by as we just get on with things, and symptoms of an anxiety response only emerge much later. Anxiety is not abnormal. Stress is necessary and useful in the short term, but unnoticed and unchecked, it can cause subtle changes in our breathing, our heart rate, and muscle tension. You might experience things like unexplained headaches, palpitations, lightheadedness, poor concentration, even panic attacks, and often general irritability. And over time, these in themselves can interfere with daily activities and relationships. Relaxation is a conscious process of focusing attention on areas of the body to become aware of any tension there might be and reducing it. The technique helps to calm the mind and the body, conserve energy, reduce pain, manage fatigue, and restore natural breathing patterns. It is different from doing something you might find relaxing, for example, having a drink with friends, reading, exercise. And like any new skill, relaxation needs to be practiced for it to be learned and applied automatically. Don't give up if you don't find it immediately beneficial. It will probably feel awkward initially. There are many ways to do relaxation. Some methods use prompts to visualize tranquil scenes or repeat positive statements to yourself. Some follow sequences to tense and release muscles. Some focus just on breathing control. I'll demonstrate now a short, deep muscle relaxation. Why not give it a try while you're watching this? So, have a nice position in a chair, comfortable, either in a chair or a bed. Symmetrical, so the shoulders are in line with your hips and knees, your feet comfortably planted on the floor. And make sure your back isn't twisted. Take a nice deep breath in through your nose. And breathe and sigh that breath away through your mouth. Again, in through your nose. And sigh that breath away through your mouth. If you feel comfortable, close your eyes. It helps to cut out distractions. And another slow in-breath through your nose. And as you sigh the breath away this time, release the tension in your shoulders. Allow your arms to grow heavy and let them rest on the arms of the chair or on your lap. And breathe normally now. Only breathe deeply and heavily 3 or 4 times because you may go lightheaded. But as you breathe out, just release a little bit more tension each time across your shoulders. And feel your arms growing heavier with every out breath. Feel your body being pulled downwards towards the ground and let the chair or the bed support you. Let the sensation of heaviness travel down the length of your arms into your hands and out through your fingertips. Relax your tummy muscles and the muscles on the inside of your thighs. Just let your knees roll outwards and allow your legs to grow heavy. Relax your body. And still with conscious of your out breath, relax any tension across your face. Imagine those frowns being smoothed outwards and downwards over your temples. Raise and lower your eyebrows. And feel a sense of heaviness around your cheekbones. Relax your lower jaw. Make sure your teeth aren't clenched together. Relax your face. Take a nice slow deep breath in through your nose and sigh that breath away through your mouth and grow heavy in the chair. Now for a few seconds, just appreciate what you've been able to achieve in a very short space of time and how your body feels. Okay, and that's a very quick relaxation, so start to just gently wiggle your toes and your fingers, just ever so softly. Rotate shoulder one at a time. Move your head from side to side, just to let your muscles know we're going to move on to the rest of your day. Well done. So, some tips. Practice makes perfect, as I said. Set aside some time daily for yourself to practice this. Find somewhere comfortable, warm, where you won't be disturbed. It's not too much to ask to have 10 minutes to yourself. It doesn't matter what is going on in the house. You may find that you want to drop off to sleep when you're doing relaxation. In itself, that's not a bad thing if you're struggling with sleeplessness, but relaxation the idea isn't to go to sleep. You need to stay awake to feel the full benefits. Sleep is good to be restored, and you need to be awake to feel relaxation. You can obtain guided relaxation CDs, which will talk you through things like I just have, talk about your breathing, muscular relaxation. We'll create pictures for you or help you to create your own. And you can look on the survivorship website for some tips and directions of where to obtain these from. Music isn't always necessary. Some people find it helpful, but if you do use it, just be conscious that there's not a rhythm or a distinct beat running through it, because that does sometimes get in the way of allowing yourself to become relaxed. And of course there are CDs and tapes that have nature sounds of birds, water, waves, etc., etc., and that, of course, they're all personal preferences. So I hope this has been helpful. You might want to rerun this particular part of the film just to get you started, but don't wear it out. Okay, well done. Bye-bye.